Health workers working on the front line in the fight against COVID-19 pandemic in Nigeria have seen it all. They have seen the damage the virus can cause, and they continue to risk their lives for the sake of humanity. Health workers are more vulnerable to the infection than others because they are frequently in contact with affected individuals. According to the Nigeria Center for Disease Control, more than 800 health workers have been infected in the line of duty. Professional photographer and volunteer medical doctor at the Mainland Infectious Disease Hospital, Dr. Femi Adewi, is here with us in the studio to talk about his experience as a volunteer doctor. Good morning. Thank you for joining us on the Breakfast Show.
Thank you, Veronica.
Now, talk to us. Why did you decide to become a volunteer doctor after years of not practicing?
Okay, I was watching COVID-19 like every normal Nigerian, and I felt that a lot was happening behind the scenes that nobody could document or talk about. So I decided that I needed to volunteer. Initially, I even tried to volunteer for Ebola back then, but my family, friends, and my fiancé pressured me to say it was a suicide mission. So this time I decided not to even tell anybody. I just convinced my wife to allow me volunteer initially as a photographer. So the first month I was there documenting what was happening, talking to patients, talking to doctors, and all other healthcare workers. So I decided that I would practice and I would join the case management team when I noticed that the patient upsurge was just through the roof and they needed more hands. So I worked first as a photographer, then joined as a doctor.
Now, from the reports we just talked about, they have doctors on the front lines and even nurses, medical personnel have seen it all.
Yes.
Talk to us what your experience was like when it comes to responding to cases.
I can say it's been a mix of emotions. There have been very difficult days, and there have been happy days, and there have been sad days. So we've had where do I start from? You see how COVID-19 destroys families. You see someone, a father, mother, and children all at the isolation center, all fighting for their lives. Or you see the breadwinner of a family. There was one that was particularly painful and I never forget. It was a senior colleague, a medical doctor, who died in my presence. And by the time I broke the news to the family, they were crying that this man single-handedly sponsors about 50 people, pays school fees of 50 people in the university. So COVID-19 has robbed those people of their benefactor. So watching and seeing that as a human being, you definitely will feel some emotions. But
did you ever have that fear of being infected?
Yes, I knew it was. It was possible, but I learned that whether I volunteered or not, there's nothing that says that my next door neighbor or somebody will not bring COVID-19 to me right at home. So for me, I just decided that it's either I join at the war front or I stay at the back lines, but there's no absolute guarantee that I could not get COVID-19 either way. So I decided that I would contribute my own quota at the front lines.
So, because there has been some reports of some medical personnel having challenges mentally because of these experiences and also working for long hours. Did you have any of such experience?
Well, it's everybody that works at the isolation center would have some level of emotional trauma. Seeing people die, knowing their stories, people your age, young people. So definitely everybody, I want to believe, who is human enough will feel some level of emotion. At a point in time, I would wake up in the middle of the night and I'll just remember a patient, a face, and I would ask myself, could I have done more? Could we have responded faster? So there's usually a level of guilt, and which is still normal. but it's now how you process it and how you recover from it. So there's a psychosocial team that is always we can talk to as doctors and healthcare workers.
All right.
If at any point in time we feel that we are losing it. But I'm grateful that I never got to that point. There were also a few colleagues that I could talk to and occasionally rant about what was bothering me, and I think all in all it was not a bad experience.
Now, for those who are watching and thinking that COVID-19 is not what it is, because a lot of Nigerians still do not believe that COVID-19 is in Nigeria, and some even think that is a virus for the rich. What would you say to them?
I would say that the numbers speak. If you ask anybody outside, have you had, for instance, loss of sense of smell, for instance? I've seen at least 40 people who call me out of the blues and say, Dr. Femi, I can't smell a thing, I can't taste. I'm fine, I don't think I have COVID-19, but those symptoms are spreading through the population. So if you ask 50 people, I'm sure at least one person will tell you they had that in the last 5 months. So COVID-19 is real. Whether we choose to admit it or not, it is real, it is here, it is spreading through the population, but thankfully we're having far more survivors in Nigeria than outside. So, but for those who say it's a lie, the truth is I'll just pray you don't personally experience it, because it is real and we all have to be careful.
Now, there's this aspect of stigmatization. You know, you initially said that your family said you shouldn't be part of the Ebola, when there was Ebola in the country. What kind of reaction did you get from families, friends, and even people, neighbors, when they knew that, when they got to know rather, that you were a volunteer?
Interestingly, even patients stigmatized us at a point in time. I can remember this day that someone was discharged, and I wanted to hug the patient, and the patient was like, I have a clean bill of health, please stay at a safe distance. Wow. I was like, oh, but you were complaining a few days ago that we weren't touching or we weren't coming close to you. So stigmatization is real, and it's because a lot of people are afraid, and it's even sometimes pathetic when there was a patient that was discharged to go home, and they got a message from home that don't come.
Really?
Because they didn't want to get infected. So she and her brother had to stay with a friend for up to 2 months before they could go back to the premises. The same thing for healthcare workers. I know some who had to stay in a hotel because there are people at home. The landlord said, if you come back to this house, we would evict you. So, wow. So stigmatization is, even for, there was a journalist that came to the center to interview us, and she got back to the office, and the messenger and some of the people in our office had taken off, and they didn't show up for the next 2 weeks because they were afraid of getting COVID-19. So stigmatization is real. It doesn't help anybody. It also can make those who are vulnerable to mental challenges to deteriorate.
It's quite interesting when I was going through your profile earlier on that you are also into photography.
Yes.
How are you combining that with your profession?
I usually say the magic word is no.
Okay.
When I'm into photography, I do not practice as much medicine. When I'm a photographer, so like during my husbandship, I stopped photography completely.
These are your pictures. These are all pictures you shot.
Yes.
How did you at this time, were you on duty or you were not on duty at this time?
Okay, initially I volunteered as a photographer for the first 1 month.
Wow.
So I was taking images. Then a few doctors had to step aside. One was infected and we ran short of doctors. That was when I now decided to join the case management. And it also helped me because wearing scrubs, being by the medical team, it was easier to get access to talk to patients, listen to their stories, and to document. So I was able to combine both. In my off hours was when I would take more pictures.
Wow. So in these pictures you're taking, what stories are behind the pictures as we're showing some of them right now?
Well, every picture has its own story. For instance, these men in yellow are those who work with the morgue, they are evacuating someone who has just passed on. This is a doctor coming out of the wards. You can see a lady behind. She's a COVID-19 patient. So there's a process of decontamination. This is an attendant who is going into the ward to clean the wards. And they have to also don the same attire, the hazmat suit, which was what we were using as when the outbreak started. They are taking food into the wards to give the patient in this picture. So the essence is to get the behind the stories, because a lot of people just assume that COVID, death sentence. But really, they are human beings behind the scenes, working hard, risking their lives to save those who are the victims of COVID-19. So my own stories are stories of resilience, to show people who are serving humanity, also to tell the real life one-on-one story of the patients, because they are human, they are me, they are you.
Now, tell us about, because I am trying to combine the two professions, as a medical doctor on one hand, and then as a photographer. No, at what point did the photography come into the space?
Yeah, so I've had to say this over and over again. So it was in my second year of med school. I said I had 6 years to study medicine. I may as well pick something else to do in the process. And medical school is extremely stressful. So I needed something to let go. So photography was a hobby. I was even nominated for a number of awards, Nigeria Photography Awards. I was nominated 4 times. So for me, I loved nature, fine arts, kind of photography. And even after med school, I was at the Nlele Institute. It's an institute for photography, and I was in about 6 workshops. And even my work has been exhibited at the very popular Lagos Photo exhibition and a few other places.
These two parallel assignments, do they conflict sometimes?
Definitely they conflict. At a point in time, that's why I said I rarely combine both, because you cannot predict your work as a photographer, and it can never be said that you lose a patient because you were not at your duty post.
Exactly.
So if I have to choose one over the other, it's always medicine. So the last 4 months of my volunteering at the isolation center, I almost didn't touch my camera, because lives are at risk. So I dropped my camera and literally worked back to back as a medical doctor.
But your colleagues in the profession, when you're not working, for instance, you said, well, when duty calls, you drop the camera for that. But when you are not working and you're with the camera, how do they engage with you?
No, like I said, what helped me is they know I'm one of them. So they welcome me.
Are they happy?
They're happy. I'm just one of them.
And then they call you, come and snap, come and take snapshots.
And I try to dissuade them from come and snap, because if you are not careful, you now become a social photographer. You're taking pictures for them to put on selfies, which is not bad, but my own point was I wanted to tell the stories of
what's the ultimate objective now? This collation of pictures you have gotten, what are you going to do with them?
Like there's been an exhibition. I was on an online exhibition by Arts in Medicine. Arts in Medicine project is a big project around the whole world, and I was a member of the fellowship in 2020. So what they do is they use any form of art to engage the people, to help people who are in the hospital to promote wellness. So these pictures have been shared worldwide. Even a few other agencies have shared them to educate people. The main objective is to promote health, to educate people so that you prevent disease.
Wow. Dr. Femi Adewi, thank you so much for what you're doing. Thank you for your volunteerism as well, because that is a service to humanity. Big time. Thank you so much.
It's a pleasure, man.